am presenting a hybrid endoscopic technique in the treatment of lumbar spine pathology. So what is hybrid endoscopy? That in which we use endoscopic different techniques with each other or another different approach, or utilization of endoscopy with microscopic surgery or another technology like the navigation. So first case I am presenting is a 67-year-old female patient having left lower limb radiculopathy. An MR image showed L4-5 disc herniation with paracentral disc over left side and foraminal and extraforaminal compression. So this patient was operated with UBE approach, interlaminar and transforaminal approach to decompress the lateral recess and the foraminal part. Post-operatively, patient improved a lot, and these are the post-op clinical images. Another patient is a 60-year-old male patient having left lower limb radiculopathy and symptom of neurogenic claudication. So this patient had central stenosis at L4-5 level and lateral recess stenosis and foraminal stenosis at L5-S1 level. So this patient was operated with L4-5 and L5-S1 interlaminar UBE approach and left-sided para-UBE approach at L5-S1 level. And post-operatively, patient improved and had a good satisfaction. And these are the post-operative clinical images for operative site. The third case is very interesting, as this patient is 81-year-old female patient, diabetic and osteoporotic, and she had a degenerative scoliosis. This patient has multi-level compression, and we can see at the L3-4 and L4-5 level, there is central canal stenosis, and L5-S1 level, there is foraminal and more of extraforaminal compression. So this patient was operated with UBE approach, interlaminar approach at L3-4 and L4-5 level, and at L5-S1 level, we went through paraspinal UBE approach. So these are the post-op clinical images, and post-operatively patient improved and doing well. And these are the post-op radiological images showing adequate decompression. So this is a recent literature in which we can see that the endoscopic spine surgery can be utilized for discectomy, decompression, and nowadays also with fusion. So in conclusion, the identification of pain generator is important, and with surgeons' skill and experience, one can choose the different available options and utilize them as a hybrid technique. And with adequate decompression, this hybrid technique can give good clinical outcomes. These are some references. Thank you.